What's up, everybody? It's your Mr. Monday. This is Kyron speaking to you on TransPOC, bringing in this week's topic, surgeries. Woo. But yes, we're going to be talking about surgeries this week and our experiences with surgeries. I first want to give a shout out to Neo, who has recently had a successful surgery. And last week he had his surgery. And I think he had it with Dr. Garamone down in Florida. I am not entirely sure, and I'm not entirely sure if I pronounced that doctor's name right. But either way, congratulations, Neo, on your surgery. I'm glad you made it out successfully, and I hope everything is going well for you, and I can't wait to hear your video about your experience with your surgery. So, just to start off, to go with describing my plans with surgery, the two main surgeries that I know I'm going to get would be my top surgery and my hysterectomy. And my top surgery, because lately I have been having dysphoria about it, and I actually intended on getting my top surgery I want to say about a year and a half ago. But at the time, I had like an employment switch, and I started working in more of a laborious environment than as far as like physical labor, and instead of like an office environment, things like that. So I didn't want me going about my surgery causing any troubles with employment and things like that, because that was a necessity during that time. But now that I have a different job and I can go forth with this surgery, very excited. The surgeon that I intend on going to would be Dr. Medali up in Cleveland, Ohio, just because Cleveland is like only a 2-hour drive from Pittsburgh, so I will still be local in a sense. And I've heard and seen great reviews and great results on his work, so I'm just preparing myself for that experience. And I did have a consult with him. Is about the time when I was ready to go forth with my top surgery, and I was going to go and do the keyhole procedure with him. And I mean, I have to look that up a little bit more, but there is a YouTube video out of his work. I'm pretty sure a lot of guys who are trans men have looked at that. A lot of people who are transitioning and looking to get rid of their top half instead of gain a top half. So, also, if you want to look into other surgeons and their results, it's also good to look on Trans Bucket. You could Google that, and it'll bring pictures up of a surgeon that you're interested in and show you the results from the patients that have went to those surgeons, and also some of them go into detail about the procedure and things like that, what they had to do and everything like that. So I'm hoping I have like a friend or possibly maybe a family member, I'm not sure, to accompany me on this trip, because it'll be a very pivotal change in my life. As far as hysterectomy, it was recommended from my PCP and endocrinologist in Pittsburgh that I do go forth with a hysterectomy sometime within the first 5 years of my transition. So I want to get that done just to make sure that everything's okay down there. And no, that's pretty much it about my tale on surgeries. I know people might be like me, where I've never had deep medical experience as far as going forth with surgeries. I've only had my wisdom teeth pulled, and I'm not really a sick person that I have to go to the doctor a lot, aside from my blood, taking my blood to measure my T levels and for T, and the yearly checkups. So but as far as surgery goes, even with top surgery, those who do not have it, just make sure you do your breast exams to, make sure you're healthy in that area, because even though we're men, it's still possible with us. It's even possible with cis men. So to have breast cancer and, cancer of that area. So, it's good to do that. Lip note as well. Another thing, let's see. Also look into your hysterectomies, because our body is changing down there due to hormone experience if anyone is on hormones and things like that. So with the loss of our menstrual cycle, it's also good to also get your pap smears yearly and make sure everything that's going on with you is healthy. Because in order to, go forth with surgeries like that, you do have to be at a healthy state. Smoking is also a bad thing to do, especially around the time close to your surgery. So one thing you'll read from surgeons, they do want you to quit smoking probably about a month or two before your surgery actually commences. So as far as payment of surgery, I don't have insurance that covers it. So I'm looking to either do some fundraising opportunities, at least get half of it. And also Care Credit is also a good resource to use in regards to going through medical procedures like that. So you can make monthly payments on your procedure and things like that. So I'm going to at least raise 2/3 of the money where I can have, if I have to use Care Credit, then I'll have a lower balance and I'm able to pay that off sooner rather than later. So I'm looking to have my surgery within the next year, and I'm very excited. And as far as my hysterectomy, probably within the next 2 years, year to 2 years, depending on how much time I can get off from work. So there's my tale on surgeries for myself. I'm pretty sure the guys have very interesting inputs and things like that. Thank you everybody for tuning in to your Monday guy, Mr. Monday, Kyron. And look forward to your Tuesday, Phoenix, Wednesday, Ting, Thursday, Caden, Friday, Leo, and Saturday, Neo. And who knows, we might have a special guest again. And who knows what that topic may be. But thank you for your inputs on your topics. And thank you for being such a great audience and supporting us in what we're doing. We look forward to hearing more questions from you, hearing more advice, any comments, things like that, because you, our viewers, make us continue with these videos and providing the information and experiences from our lives. So you know how I roll. The oh so wonderful peace, love, hair grease.